today I'd like to welcome Dr. Jenna, a naturopathic doctor. And today she's going to be talking about periods. So we know that despite getting a bad rap, that your period really shouldn't be disrupting your life on a monthly basis. So Dr. Jenna today will be discussing what's actually normal when it comes to your period. And actually, that means that it's not supposed to hurt or be painful, when you should be seeking help, as well as what you can start doing to achieve the regular painless periods you should be having so you can have more time to enjoy life. So, welcome, Dr. Jenna. So nice to have you here again.
Hello, thank you so much for having me.
Wonderful. So, you know what? I'll let you do a brief introduction on yourself if you want to tell us a little bit about yourself and your practice.
Sure. So, hi, I'm Dr. Jenna Priestap. I have a virtual practice and I focus more on women's health, and especially when it comes to periods. Because at least for me, I know growing up, periods were very like taboo and no one talked about them. And most women that I knew actually had very painful periods. And it wasn't until I was actually in med school that like naturopathic med school, that I found out that your period actually shouldn't hurt. And it didn't make sense to me why most women didn't know this. And so my practice is really around helping women have the regular painless periods that they're supposed to be having, despite that's not what's common, basically.
Right.
That and really helping with postpartum, a very maternal focused practice, but especially when it comes to the first year postpartum and painless periods.
Wonderful, wonderful. Okay, so you've already kind of segued into that. So, can you tell us what is a normal period? Like, what does that mean?
So normal actually means that if you were to have a cycle, you want to be having a regular cycle every 28 to 34 days. So that's actually the first day of bleeding to the next first day of bleeding, 28 to 34 days. The actual bleed itself, the flow is 4 days to 7 days. And when we're even talking about how much flow there actually is, to quantify it, it's 50 to 80 milliliters. And that might be kind of hard to understand. But if you're someone who uses, say, regular pads or tampons, those hold about 5 milliliters each. So that equals 10 to 16 regular pads over the whole period. Or if you use super, those hold about 10 milliliters each. So it's about 5 to 8, which when I explain that to many women, they're like, I soak through a super pad within 2 hours. Like, and they
Mhm.
think that's normal when it's not. Also, there shouldn't be any pain whatsoever. If we were to quantify it, 0 is no pain, 10 is the most. You're max at like a 2 to 3 out of 10. That should be like the cramping. On pain in general, like no headaches. You shouldn't be getting acne. And when it comes to the blood, a lot of the times there's clotting, and they shouldn't be actually any bigger than a dime. Whereas, again, I've talked to countless women where they're like passing golf ball sized, and they just think that's normal. But that's just,
Yeah.
but common does not mean normal. And that's just basically what I want to shout to the rooftops, to kind of help women realize what they should be experiencing.
Yeah, absolutely. And you touched on this already where it's true, like for years women didn't really talk about their women's health specifically, right? We spoke about health in general, but not necessarily women's health. And so to really be starting this conversation about what a normal period looks like and not so normal, and for women to be familiar like that they really don't need to be suffering with these symptoms, right? So yeah, so you know, you've kind of gone through what a normal period means, and I love how you said like exactly like how many pads or tampons you should be using, because yeah, this it's not known out there, right? So I love that information. I think that's super helpful. But yeah, like kind of getting into some of those common maybe symptoms yet not normal, and when should women also feel like they should be seeking help really with this?
Yeah, for sure. So first and foremost, if your period is holding you back, from anything in life.
Mhm.
If you have to take a day off work, or if for my young women, like if you're taking a day or two off school because your cramping is so bad, anytime your period is getting in the way of life, you should be seeking help. If you have pain, again, that pain scale always comes into play. 0 is no pain, 10 is the most. If you are at higher than a 3, 2 to 3, you shouldn't have to suffer through that. You should go ask for help, go get some investigations done. And if you have another common thing, which actually isn't necessarily normal, is like diarrhea and vomiting from the cramps and the pain. If you're experiencing that, you should be seeking help, because I've seen women who they can't leave their home, or if they go out, they need to know where a bathroom is, basically, because they just have such bad diarrhea when they're on their period. Some women that I've worked with, they throw up, like without a doubt. Every month they're throwing up because the pain is so bad, and that 100% is a time to be getting some help, instead of just trying to power through it with Tylenol, heat bag, anything like that. Instead of trying to tough it out, like seeking some help and actually getting some support, that's definitely when you should be getting some.
Yeah, absolutely. And so, so then women possibly they're going to their doctor. Usually, what would you say most women encounter in the sense of like, what are some of the investigations that are done? Like, what is their doctor saying? And maybe they've gone to their doctor and everything's like normal, right? Like, oh, what you're experiencing is normal. Like these period cramps are normal, and the amount of bleeding, like this is normal. What sometimes comes up, what could be causing these issues? Yeah.
Yeah, for sure. So a lot of the times women will go to their doctor, seek help. Maybe they'll do like a pelvic ultrasound, which is great. We want to make sure there aren't any fibroids in there, any cysts on your ovaries. They may get like some blood work to assess if there's a thyroid issue. And again, if these are normal, but then you're kind of left with no answer. Basically, what happens is a lot of women are told, okay, you have the pill. That's your option.
Yeah.
That actually just turns off your hormones. So if you have horrible periods, then you go on the birth control pill. Yes, it is a great band-aid solution. It's going to get you through. But what happens to a lot of women that I work with is now they want to try to have babies and they're off the birth control pill. Well, everything that you were experiencing when you were younger comes back, because whatever's causing that period, that bad period, hasn't changed. It's just been a band-aid solution, basically. So things we want to look at are going to be such as like, what's your estrogen and progesterone doing? Estrogen is important for the first half of your cycle. Then it's progesterone that's important for the second half. Basically, they do this beautiful like dance, and if there's an imbalance between one of them, it's going to cause, you're going to see it in your period. The characteristics of your period tells you so much about what's going on with your body. For example, if you have too much estrogen, more of like an estrogen dominance picture, this could be leading to extreme breast tenderness, clotting, heavier bleeding, things like that. If you have more of like a progesterone deficiency, like on the other side, this is where you're going to start seeing like spotting, especially like before you expect your period to happen. Then if you have spotting in there, that could be progesterone deficiency. So those two hormones we want to be looking into. Also, your overall inflammation. So if you have high inflammation, and you are experiencing those period poops that I talked about before, just the perfect name for them. When you have inflammation, you have an increase in these molecules called cytokines. These are important. These help your uterus to contract. Now, these are great. Yes, we want your uterus to contract, get the lining out. However, when we have too much of them, so too much inflammation, too much cytokines, it's not only going to be working on the uterus, but it works on the surrounding tissues, such as your colon. So it's going to be pushing that poop quicker through, hence diarrhea. So something that we want to look at is what's causing this increase in inflammation in your life. Is it your diet? Is it certain products you're using? This is where a personalized visit comes in to see what specifically is causing it for you. But another thing that could be contributing also is stress. And in our society, stress is just rampant. Like people are functioning at such a high level that they don't realize it until their body is telling them this. So cortisol, your stress hormone, and progesterone actually come from the same basic like parent hormone, if you want to call it that. So your body is going to shunt basically all your resources to cortisol production instead of progesterone production, because cortisol is released, you're stressed out, it thinks that there's a threat. This could be a real threat, someone chasing you, or you're trying to reach a deadline, you're stuck in traffic, things like that. Your body thinks that it needs to survive, so it's going to pick survival over procreation, over sending it to progesterone to give you that good period, basically. So this is something else that needs to be looked at. Basically, the big ones overall: inflammation, stress, and the estrogen progesterone balance. How much and when they're peaking, basically are important to look at as well.
Yeah, that's great information. I don't think anybody's probably really heard it explained that way. So that's wonderful. Now, what about I'm just going to ask you about like PMS a little bit, because I feel like so many women think like, well, it's just normal. It's normal to have like these PMS symptoms. And I know you've kind of talked about like heavy periods and even like headaches and breast tenderness, like, during the period. But again, like, should women be getting PMS? Is that normal? Is that common? Is it, is that something that they should be talking to their doctors about, or yourself?
Yeah, for sure. So when it comes to PMS, like women are cyclical beings. When we're in that luteal phase, like that's the second half of your cycle, you want to be more rested, slowing down. However, again, if you're functioning in normal day society, you're not doing that exactly.
No.
And that's going to push anyone into being more, your body wants to be resting, but you're not. So yeah, you are going to be a little more irritated. However, again, it shouldn't be interrupting anything in life. It shouldn't necessarily be like, oh, like you're feeling either. I've seen women that feel very low before their periods, and or just very angry, very irritated. Like you said, the breast tenderness, all of this, like to a degree can happen, but in no way should it be something that's interrupting your life. No way should it be something that's like, oh, here we go, my period's coming, my breasts are so tender right now. Like that, actually, it shouldn't be that much. It could be more so something like, oh, I'm a little weepier than usual. Like, okay, like maybe my period's coming. Something it The biggest hallmark that if anyone can take anything away from this is basically if it's interrupting any part of your life, then you should be seeking help. Because again, you don't need to tough it out. You don't need just to deal with this, because it doesn't feel good to be feeling cranky. It doesn't feel good to be weepy, irritated, and to almost just blame it on your period is kind of, with tough love, a cop out. Like,
Yeah.
so you
Yeah.
could actually be enjoying your life all month long just with the right supports.
Yeah, absolutely. And I think that's such an important conversation that women should be having, because they definitely need to feel like they don't need to be suffering. I mean, we get our periods for our whole life, essentially, right? Like the outside of, when you're a child or when you're in menopause, like so many years. And to really, if somebody is suffering every single month, just to know that there is help out there, I think is amazing. So if you can kind of give some suggestions on, what women can start doing really naturally to get, that regular painless period, that we all should be having, what are some suggestions that people can kind of start with?
So first and foremost, always getting an initial assessment with a naturopath is going to help, because that way everybody's different. So what Susan needs to work on to get her the painless periods, well, Sarah might have something different. So definitely getting someone to do a full assessment, see what you specifically need so you could get the proper supports in place. That's going to like speed up your results. But on the other hand, too, like we talked about, so inflammation is a big one. Trying to reduce the inflammatory foods that you're consuming, the foods that you're craving before your period, the sugar, the grease, all those things, the processed foods, those are then increasing those cytokines that we talked about, which are making your period worse. So it's almost like this cycle where it's like you're craving it, you're eating it, and then it's making your period worse. It's just like perpetuating itself. I actually have a period pain reducing meal plan. We can link maybe for a start at least. But yeah, reducing your inflammatory load, reducing stress is another big one that anyone can start like right now. Identifying the stressors in your life. And again, this can be where a naturopath can help. If sometimes you don't see the certain stressors that are happening and how your body is responding to them, you don't realize that certain things that are coming up is actually more of a stress response. So reducing your stress, reducing your inflammation, and yeah, just getting that initial intake is helpful big time.
Absolutely. Getting started, getting recognized, getting to speak with somebody who understands, right? And I think too, like you said, everybody's plan, like you go to see a naturopath, everybody's plan is going to be different because everybody experiences their period differently, right? Like in the sense of different symptoms or different concerns, right? So not everybody's plan is going to be the same. So I think that's great that, you offer that, obviously, like that individualized approach. So I think that is amazing. Wonderful. Okay, so yeah, I don't know if there's any, oh, no questions. Okay, so yeah, I guess we will wrap it up then here. Thank you so much. I think this has been so informative. I don't know if you have any last tidbits of information, but obviously we'll be linking this webinar to all of your information. So if anybody wants to get a hold of you, they can, because obviously, an individualized treatment plan for anybody, any woman at this point that's trying to really, get that period health to the next level, they can definitely contact you for further information. So that's wonderful. But yeah, any last kind of like takeaway that you want to tell everybody?
Basically that you don't have to suffer. I just want, one of the biggest things in my life right now is just kind of I want women to understand what they need, what they should be experiencing, and what they don't have to go through anymore. Because I find a lot of the times women tend to just soldier on and keep pushing through things that they don't need to. And it's almost like, well, it's just part of being a woman. My aunt used to call it the curse of the woman and stuff like that. And it doesn't have to be like that. So
Yeah.
just if you ever are concerned, or even if you're like, can this be better, reach out to someone. I'm here. You can always like DM me to see like, hey, this is happening, is this normal, can this be improved or anything like that. And that's the best thing you can do, is just always reach out.
Amazing. Yeah, keeping the lines of communication open, right, between us women, so we can definitely help
Yeah.
support each other. So wonderful. Thank you so much, Dr. Jenna. It was a pleasure. Thank you so much for being here with us. And we'll have the recording up so anybody can enjoy it afterwards. Yeah, and hopefully you'll come back for another session at some point in time.
Yeah, for sure. Thank you so much for having me. This was a blast.
Okay, take care. Thank you. Bye-bye.
Bye.